Hi everyone, so welcome to this evening's Cam Live. So I am very, very, very lucky to be joined by Michael, who is coming to us all the way from Connecticut to talk to us about the links that we see between pain and behaviour, which we know is such a common problem and something that we see so frequently with both the pets that we're seeing in practice and also our own pets. So there's a couple of little sponsor messages we are going to quickly go through. So first of all, I'm just going to play you our beautiful sponsor message, which is from Barker Beds. Now they're obviously one of Cam's big sponsors. We're very lucky to have this support from them. So I would encourage you to go and check out their website, have a little look at all their products. We know these are fantastic beds, having a really good level of comfort for your dog when they have got arthritis. It's just super important to make sure they get that rest that they need. And then also just a little reminder that the Big Walk is back. So this is Cam's annual event. We have still got time to sign up for the Big Walk 2022. So it's going to be happening at the end of this month, so through September. And one of the big things that's different about it this year is registered veterinary nurses are able to sign up for the Big Walk for free. So any RVNs who are watching, or if you have got any friends who are RVNs, please let them know. They can get signed up and get all of the useful resources that go along with that completely free of charge. So with those out of the way, we can jump onto our conversation. So Michael, if you would like to introduce yourself to all of our lovely followers, that would be amazing.
Thanks so much, Jenny. I'm really excited to be here. I'm back again talking about pain-related issues and behavior. That's kind of what I focus on. So I'm a little different than some of the other guests, some of the other professionals that have been on, all veterinarians. I know there's been a lot of veterinary professionals on. I am not a veterinarian, but I do specialize in behavior. That's what I focus on. And the behavior I do focus on is aggressive behavior in dogs. And so I hope to get to talk a lot about that today. I own aggressivedog.com. And my goal is to really just help educate others about how to help dogs with aggression issues, because oftentimes they're misunderstood and there is help available for them, especially the dogs with pain issues and arthritis issues. So we'll jump more into that, I'm sure.
Yeah, definitely. I mean, I can certainly remember cases that I've seen where, dogs have come in and they've had a label on their file saying, oh, this dog's aggressive, you need to be really careful with it. And then actually, when you kind of really dig down into it, you find that it's not. There's a cause for things in there. And I think if we're able to get to the root of that and fix that problem, great, it's so much better for that dog. And maybe we should be looking at this as a symptom or as a warning sign to say to us, let's just make sure there isn't anything else going on with that dog. I certainly, if I've got a sore back, I'm going to be very grumpy that day, especially if someone's trying to poke around and do things with it. And it's very frustrating sometimes to see dogs with that label that then follows them around, sometimes for the rest of their life, when actually it's something that we as professionals and can be doing something about, but equally that as owners, we could be recognizing that and bringing that to our vet's attention to help them understand what's going on with their dog. I mean, I'm sure you must have seen similar cases in your practice.
Absolutely. I think, and you bring up a really important point there, Jenny, is that what labels we use are really important, because look, I mean, think about the difference between when you picture in your mind for a moment, when you hear me say, that's an aggressive dog or that's an arthritic dog, which one do you kind of, what pictures do you come to your mind? How do you feel about those terms? How would you feel about a dog? Do you want to adopt my aggressive dog or do you want to adopt my arthritic dog? Completely different mindsets of how you might take care of that or take care of that dog. So we really do have to be careful, because many of these dogs that do have underlying pain issues might show aggressive behavior simply because they're in pain, or they're just trying to kind of defend themselves from our human poking and prodding that we might be doing that we're not even aware of when they are in pain. So, and I can think of certainly many cases over the years in which it was often initially looked at as the dog's being stubborn or aggressive or willful or spiteful or trying to be top dog, and all of these misnomers, unfortunately, that put that dog into a category that may follow it around for its life. And so we have to be very careful about it, definitely.
I think it's really interesting what you say about, if you've got two dogs and one's labeled as aggressive versus one's labeled as arthritic, because Yeah, absolutely. There's a very, very different kind of mental image that comes with those dogs, where actually it could well be the same dog. It's just that one of them has had those investigations and had that diagnosis made, and there's the cause found, and the other one, unfortunately, maybe hasn't had that chance to have that label corrected and adjusted to be the more appropriate one for them.
Absolutely. Absolutely. I can think of, speaking of cases, one classic case that I had that could have went very tragically, because sometimes when dogs do display aggressive behavior, more, significant and serious outcomes can happen, whether it's rehoming or euthanasia, because of the behavior. And if that underlying pain is missed, how tragic for the dog, right? Where it's something like that can happen. So there was one case that it was missed by quite a few professionals. So the dog had been to the veterinarian, the dog had worked with a couple different trainers, and in the name of trying to help the dog's aggressive behavior. But further digging revealed that this dog had a lot of different health issues, not just, spine issues and joint issues, but a number of other health issues that were impacting the behavior. And those were all missed, by professionals. So trainer going in and doing really not so nice things to the dog because the dog's being stubborn or dominant. And they're using these terms. Think about how tragic. Poor dog is just saying, hey, I'm hurting here, so please don't keep yanking on my collar with the leash on. And then the first trainer goes in there and is continuing to do that. And tragically, that was the first bite that the dog inflicted to was that trainer. So really awful outcomes can happen when we miss those things. And so it needs to be talked about a lot more, not only in, the pet owning kind of community, but also the professional community as well.
Yeah, and that kind of stubbornness you talk about, that's a really common thing that I see when I'm taking history for a dog that isn't necessarily escalating things up to that point of sort of aggressive behavior, but the owner's brought in and said, oh, they're slowing down, they're not wanting to go on their walks as much, I put their lead on, they're slamming the brakes on, they're stubborn, they don't want to go out.
Right.
Like, actually, is it that they're stubborn, or is it just that they're desperately trying to communicate to you in the only way that they can, that I'm really sore today and I don't want to do that? And it's those subtle things down at the bottom of that ladder that if we're missing them, we miss that opportunity to help these dogs before they get, as you say, further down that line.
Yeah, when you think about it, when you further muddy sort of the waters of understanding this behavior, you give a classic context in which it happens. I see it quite often where a dog is out on a walk and then they stop on the walk. They kind of balk, they plant all four paws and they don't want to move anymore. And the client might remark, oh, he's just so stubborn. He's just being so spiteful to me. He's just, he's getting back at me yesterday because I was upset because he chewed my shoes or something like that. And so they put these different reasons on it. But oftentimes it's just the dog's in pain or the dog physically does not want to keep going any further because that walk is painful for them. That's just one context. Here's the other one I see that tragically happens a lot is the dog's on a couch or a bed, the owner's bed, and maybe the owner doesn't want them up there or something like that. But the dog is simply just looking for comfort. So that's why that's good. Good shout out to the Barker beds that you showed in the beginning. Comfortable place to rest because they're seeking out, just like us as humans, we want to go, lay in bed after a tough workout or being sore or in pain ourselves. And so if somebody comes over and tries to say, hey, get off that bed, move it off that bed because I don't want you to be dominant or turn into the alpha dog or all these other misnomers, then what do we do next? Sometimes people do things even more tragically. They grab the collar and be like, get off the bed. And then the dog growls at them or something like that. And then it's blamed on dominance or some other spiteful or willful or stubborn label we give it. But that's absolutely not the case. And think about tragic if it goes further, right? And that person's like, okay, on the advice of my trainer or something I read online, I'm going to pin the dog down and tell him I'm boss, something like that. So now you're making the pain even worse. And the dog responds in an aggressive manner, and it's blamed on those labels of stubborn, dominant, and all those other things. So that's a very common one I see where simply an owner's just trying to get the dog to move off of something or point A to point B, and they do it physically or they escalate their force or they start to punish the dog, and that never ends up well. Right? Dogs
No,
always
and
say, I don't feel like moving today. I'm going to let you know with my teeth.
yeah, and that's, it's that you're taking away their other options to be able to display that or try and communicate that behavior to you, because they've already tried that, but we've misinterpreted it as that stubbornness, as that dominance. And actually it's just them going, please don't make me get out of bed. My knee's really sore today. I just want to stay here. This is the comfiest place for me. And it's why I know one of the things that Cam really talks about for our owners, and it's within our kind of management pack, is talking about kind of indicators of pain that are specific to that individual dog, because that then helps you guys as owners be able to identify when your dog is actually having a bad day. So a dog I saw today, for example, the way the owner could tell me that they were feeling better versus worse was how they were stepping up onto the sofa. So the fact they were using each paw individually rather than bunny hopping on the back legs. And it takes that really good understanding of what's normal for your dog to be able to recognize when things are starting to go wrong. But actually then, as a vet, it's amazing if you can come in and point those little things out to me, because it means we can get in there, help with the things that we need to do, make sure there isn't a source of pain before we start escalating things up into the situations that Michael's talking about. So, it might seem like nothing, but actually those tiny little nuggets of information, so useful for us to be able to get that proper, really, really good detailed history and make sure that we are giving you A, the most appropriate advice for your patient, but also B, the tools to recognize what's actually going on with your dog and learn to speak their language, have that bit of a two-way communication with them.
That's the key phrase you just said there too, is that, learn to speak their language, because over the last maybe decade or so, a lot more information has kind of reached the masses about dog body language and what they might be communicating. But what I like what I'm seeing now, especially with resources like Cam, is that there's more information about recognizing pain or discomfort in dogs, which there wasn't a lot at all, even just a few years ago. So it's nice to see that this information is getting out there, and I hope that it continues to escalate and really spread, because it's such valuable information. Because let's face it, just like dog communication, there's subtleties. Like it's really obvious if a dog is limping or in overt pain, but sometimes we don't notice the subtleties. Just like if we may not recognize subtle communications, like a subtle tongue flick or a lip lick or head turn or whale eye, all the body language cues I look for when a dog is feeling uncomfortable. We also have to look for the physical signs in what a dog might do. So educating the everybody out there that has a dog, is working with dogs, it's really important, because it's sometimes missed. And just like anything else, it takes time, to learn. You get good at noticing the overt things, then you start to notice some of the more not so overt things, then you get better at even noticing the little details, just like maybe a dog, how they get up out of their dog bed in a certain way, or favoring one side, or watching their gait as they walk. And a side note too, for all my clients and for my students as well, I always recommend videoing the dog. If you can get the dog in there moving or doing other things, like getting up out of a dog bed or moving around, getting that video, then you can show it to the veterinary practitioner, so they can observe, because usually they're going to be able to pick up things that we can't see. Even trainers or people that don't necessarily focus on pain or diagnosing pain may miss those things, but a veterinary practitioner will be able to do that. And they may only be able to do it with the video, because sometimes you take the dog to the vet's office, right? And the dog's like, I'm not moving anywhere. So you can't actually see them walking. So you miss what you might see at home. So,
and especially if you've got a dog who has kind of had those, potentially negative experiences in the past. They've come in, they've been sore, someone has had to move that joint around. So they're going, do you know what, this time I'm just going to sit here and I'm just going to shut down. So yeah, absolutely. Videos are fantastic for us to help diagnose them. Slow motion videos are amazing as well. Near enough every smartphone now has got the ability to do slow-mo videos, and they are so helpful for looking at gait patterns and, just being able to A, as a vet, look at what's normal for them at home, but also B, for you as an owner to show us what's going on. And yeah, they can be really, really helpful, and also much nicer for the dog. It means we can sometimes be a lot less aversive in a consult situation and try and really work with that dog within the limits of what they are happy to allow us to do, but still hopefully get to the point of a good plan and a good outcome for everyone, where we can make sure they're getting the treatment they need without having to distress them further in that initial visit.
That's such a good point, because let's face it, going to a vet's office can be stressful for many dogs, and we try to make it as comfortable and as a nice experience as possible. But why push them to do further things that are icky for them in the vet's office if we can avoid it by getting video and taking data and keeping track of all of these things that we're noticing at home? That way we don't have to replicate it in the vet's office in an already potentially stressful situation.
Yeah, absolutely. And it's so much nicer for the dogs, because then they've got that chance to build up a positive relationship with the practice. And, as I'm sure many of our owners know, unfortunately, if you have got a dog with a chronic pain condition, you see a lot of your vet practice. You want your dog to not feel bad about going in there. We always want them to have that positive experience when they're coming in. So anything we can do to minimize the sort of nasty things or the things they perceive as the bad things, it's going to make that relationship so much better for them, and also for you as an owner. It's going to make it a lot easier for you to communicate to us what you're worried about and what's going on with your dog.
Absolutely.
Yeah, and those videos can be really useful as well for us as vets to then involve other professionals like Michael. We can send them over and say, look, I've got this dog, our owners are concerned about these behaviors, this is what I'm seeing when they're at home, I'm just not seeing it when I'm with them. Can we have some help? Can we work together and come up with a plan for them? And I guess that sort of link between vet and behaviour is a really important one, because we're two different sides of the same coin working together. Whether that's for me being the one that's prescribing pain control medications and figuring out what's going on, versus your side of it where you're looking more at the behaviour side and supporting the owner, supporting the dog through all of that.
Absolutely. It's such an important kind of trilogy or teamwork between the owner, the veterinarian, and the behavior professional. In many of these cases, especially if it's aggressive behavior, vast majority of those cases, you should be working in conjunction with a veterinary professional, a trainer, and of course the owner, because that's really the best way to help the dog, if we're kind of covering all the bases to make sure that we're not missing anything.
And I think probably, unfortunately, one of the things we do need to touch on is there is a lot of variety, should we say, in the degree of experience of different trainers who are out there. Obviously, I know you're based in the States, so the sort of qualification side of things is a little bit different, but certainly over here in the UK, it's making sure if, as an owner, you are involving a behaviourist, speak to your vet and, find out what qualifications they would recommend that you're looking for, so your professional is doing things in a way that we want to happen, rather than, unfortunately, some of the older, more outdated schools of thought.
Very important point, because unlike Jenny, who has a veterinary degree and has gone through school and licensing and gone through the proper channels and could technically be prosecuted if she says I'm a vet and didn't have the degree, unfortunately, trainers and behavior consultants and self-described behaviorists are not regulated. So anybody, can you imagine if somebody like your friend at work was like, I'm going to be a veterinarian today, so let me see your dog, and you were to trust them with all of that, I'm going to perform surgery on your dog, obviously you wouldn't do it. But unfortunately, trainers, anybody can say they're a trainer. Anybody can say, I've watched a few TV shows, now I know and I've taught my dog how to sit, so I'm going to go out and take money from people to train their aggressive dog or something like that. And so you do have to be really careful. So there's definitely looking for people that are certified, have some sort of certification. There's several different organizations that certify, and you're going to look for independent certification as well. So somebody that it's not just from a school, because a lot of schools hand out certificates, which aren't the same thing as certifications. That'll be a good first step. You're looking for science-based and positive reinforcement in some of the language as well. That's going to steer you in the right direction. But it's always good to interview that trainer. What is your experience? What are you going to do to my dog? And what are you going to do good two questions asked. What are you going to do if my dog does something wrong? And what are you going to do if my dog does something right? And you're always looking to see much heavier on the side of what do I do if my dog does something right? Because we want to reinforce desirable behaviors and not punish undesirable behaviors, especially in these cases, because the worst thing you can do is punish a dog when they're just trying to express that they're in pain.
I really love that. That's such a simple question to ask a trainer, but it tells you so much about what their practice is going to be. And it's a little bit like I sort of always encourage my clients, we have multiple vets within our practice. I've worked in huge practices. There is a degree of finding, that personality who fits with you, who you're going to be able to work with and have that good relationship with. But that baseline foundation of, I really love that, how are you going to reward my dog when it does that well versus, when it doesn't? That's a really lovely, insightful question for people to be asking.
And I think for some reason there's a lot of mystery around like dog training and behavior, but if you compare and contrast to just like humans, and we were to say, my child has a leg injury or something like that, and then the physician comes in and says, okay, we're gonna treat this issue just like a veterinarian would, but then recommend somebody that trainer or the person that's going to help with helping with the rehab aspect of it, or teaching your child how to walk again. It's like, okay, you need to be the pack leader. You need to dominate your child and pin them down. And if they don't walk, you would never go with that person. But for some reason, sometimes in the pet owning side of things, they're like, oh, okay, that's if the professional's saying to do that, I guess I'll do that. But so you do have to be very careful.
Yeah, and obviously for everyone sort of UK based, have that conversation with your vet. If you are seeing those behavior issues, like we're talking about, so many of those can be linked to an underlying pain condition. That first port of call should be vet's full clinical exam, make sure there isn't anything else going on there, and then you can have that discussion with them about, they are going to have knowledge of who in your local area they're aware of, who has got those certifications, and be able to sort of point you in that right direction. Because unfortunately, as Michael says, there are lots of, if you pop dog trainer into Google, lots and lots of people will pop up, but you've not got that sort of background knowledge and awareness of, are they actually the right person to be giving you that appropriate advice for your dog? And obviously the last thing that any of us would want to see happen is a dog who's early on that scale, they're on the sofa, you're trying to move them, they're having a bit of a grumble, so you get someone involved who maybe isn't doing things how we would want to be, and that escalates upwards, and you then end up with a dog who's got that label attached to them that's going to follow them around for the rest of their life. And I know you're sort of quite passionate about that labeling aspect and making sure that we're not giving these dogs tags inappropriately.
Yeah, it's again something that I think we can kind of segue into this too is why the dogs do it. That's more important to focus on. It's not labeling them something or saying it's territorial aggression or pain related aggression. It's good to kind of dig into the underlying reason for the behavior in the first place. And many cases, it is the underlying medical component of the pain. So rather than saying, your dog is A, B, or C, it's your dog is doing this because of A, B, or C. That's how you really help the dogs. Is your dog fearful of people or men in strange hats or something like that? Or is the dog in pain and react to that pain? Is the dog guarding something that they don't want to lose access to? And so once we identify that, that's how we truly help them. And that's what I focus on in all of my aggression cases. It's not so much, trying to label the dog. It's always focusing on why, understanding why. And when you do that, that's how you can best help the dogs.
And it comes back to that lovely, which dog would you rather adopt? The aggressive dog or the arthritic dog? They're the same dog, potentially.
Exactly.
We were sort of talking about this. I was chatting with my colleagues in the practice before this evening and saying, there will be situations where we have to place a label on a file as a sort of safety warning for everyone. But that doesn't necessarily mean that automatically every time that dog comes in, we're going to assume the worst. It's trying to get to the root of what's going on and making sure that we're making them as comfortable as they can do, obviously within the confines of safety. And that it is a really important point to make. If any of you are worried about behaviors that your dogs are displaying, safety is a really, really important thing. If they're giving you those warning signs, you need to give them that space. It's making sure that any advice you are following is appropriate and from the right people, to make sure that you're not doing anything worse for your dog, but equally that you're keeping yourself safe at the same time. Yeah, and it is difficult. It is really difficult because you worry about them. We all worry about our pets, and it's that good communication between you and pets, being able to understand those early warning signs. That's what's going to give you the chance to get in there and help. But even if we have got a dog who's got to that point, so they maybe have escalated up that ladder and there has been an incident, that doesn't necessarily mean it's the end of the line. There are absolutely things that we can do to help, and that's obviously where professionals like Michael start to come into the equation as well.
Yeah, the understanding aspect of it is probably the most important thing I can help clients with, especially if anybody's listening that's had their dog direct aggression towards them. So I would classify that as owner directed aggression. The top 3 reasons for dogs that might bite their owners or go after their owners, the number one reason I usually see is some underlying pain issue. So once I help them understand that, it really shifts the dynamic, especially if they don't realize it's pain and they think their dog's, again, being that stubborn, willful, spiteful kind of thing. So helpful for them because it completely shifts how they feel. They're like, oh, it goes from, oh, my dog, how dare they, to, oh, my poor dog, now I want to help them kind of mindset. Some of the other common ones are, of course, dogs that guard things in their home. So resource guarding is probably the second reason for owner-directed aggression. And the third one comes tragically out of trying to treat those first 2 issues often. It's owner-directed punishment. So that the owner's just simply trying to make things better for themselves, and I never fault the owner because they're just trying to do the best they can with the information they have at the time. So going online, maybe researching themselves and using techniques that might be punishing, squirt bottles, or all the way on up the ladder of doing not so nice things to the dog in the name of trying to fix the behavior. But those top 2 reasons, pain and resource guarding, are often really straightforward to treat and to change, but we don't want to do it through punishment. So if we understand why the dog is doing those top 2 reasons, the dog is either in pain or they're just trying to protect something of value. We do it we do it as humans, right? Think about the pandemic and
absolutely.
hand sanitizers and toilet paper. We resource guard that stuff too at first. And so same thing. We it's very normal behavior for dogs to guard things that they find of value. So if we understand that, then again, that allows us to change the behavior more efficiently without confrontation and without doing anything worse to make it worse, which again, those 2 things, if you start punishing the dog, it often does make it worse.
Absolutely. And, it's just making sure that, I mean, we've had a comment come through that said, so many dogs are euthanized before intervention. So sad. And it is, we see it not just from an aggression point of view, but from an arthritis point of view. We see lots of these patients where those early signs haven't been recognized until they're at the point where the owners have sort of hit that limit of, where they feel things are acceptable. And, it can be, as professionals, quite difficult dealing with those cases when that there were those little signs there that maybe just weren't quite picked up on. I wonder if you'd be happy sort of talking through some of those earlier things that the owners might start seeing before things escalate up to the kind of bracket of them.
Definitely. And to whoever made that comment, it's such a pertinent comment to this conversation because I've seen so many tragic cases. One obvious one, I think I talked about it maybe in the last interview for Cam, but it was this racing greyhound. And when you think about retired racing greyhounds, that's something they have in the States where they have these dogs. They really
here as well.
Push them and work them out. Fortunately, it's becoming less and less common, but you've got to imagine, you've got like a dog that's been trained to an extreme level or work to extreme level and like an athlete would, and then they retire because of injuries and, just like sports injuries that people get. And this poor dog was, just communicating in so many obvious ways. And so the dog would sometimes growl at the owner if they try to push it off the couch or move it while it's sleeping. I mean, all these very obvious ways, telltale signs. But unfortunately, this dog had even worked with professionals. The client had worked with a couple of professionals earlier, and nobody noticed. Just such an obvious thing, It's so any Greyhound people in the group or listening in will know what I'm talking about. But it's so those are the tragic cases. So I constantly am on this about if there's maybe I should cover some of the scenarios in which I usually see dogs that do have underlying pain or medical issues. So some of the common contexts. So it may not be so obvious to the owner at first, but things like putting on equipment. So putting on a collar or putting on a harness or trying to clip a leash on. And it usually runs opposite to what most dogs will like. They're like, oh, all right, we're going to go for a walk. So they get all excited because they see that leash come out. But sometimes you might see that. They're like, okay, that leash. And they go, oh, wait, that might hurt though. Because sometimes it feels a little funny when you try to pick up my arm to put the harness on or something like that. And so it may seem very conflicting to the owner. They're like, oh, wait, I don't get it. He wants to go for a walk, but then he bit me when I tried to put his leash on or tried to put the harness on. That is often speaking loud and clear. The dog has some pain issue or some negative association. And here's the other thing too, is that even if the pain has been sort of deemed cleared up or the issue's been addressed, there sometimes could still be some underlying pain going on, or an association has been created that, hey, when my harness goes on, it could be painful, even though the issue might have been addressed and all healed up. Dogs are very good at forming quick associations to negative events. Be like, okay, that harness predicts pain, not it's because of my arthritis. They can't diagnose. They don't know what's going on there. So they're not saying it's because of my arthritis that it hurts. It's that harness that hurts me. So putting on equipment, anything like that, certainly any kind of touching, petting, reaching towards the dog is another one. And that's another one that gets a lot of people conflicted. Like, I don't get it. Don't dogs like to be pet, or my dog loves the attention. And you might see that where we're petting the dog. And this is a very common one, actually, is where somebody's petting their dog, right? So the dog comes over to you, they want the comfort. They come up and curl up on your lap or lean in next to you on the couch. And you start petting them. And after about 30 seconds, that's when the dog then escalates suddenly. They start to growl or snarl or snap or bite you. And many times, again, because the dog is still in pain. Either they're just seeking the attention and they don't want the petting. They just want that nice, warm, comfy spot next to you, but don't actually want the petting. Or they want the petting at first, maybe just a little bit, but then it comes like scratching like an itch, and then you keep scratching, the itch goes away, but then it starts to hurt. Or deep tissue massage. It feels good at first, but then it starts to hurt, and the dog's like, ow. And so that's another common context I see where people get conflicted about what's happening. I don't get it. I mentioned trying to move the dog off of things, getting off of comfy beds, furniture, even their own dog bed. Simply walking by or even shuffling your feet by the dog can be a big issue, because they might be like, oh, sometimes when people walk near me, that one time somebody stepped on my paw or shuffled me out of the way or nudged into me while I was moving. It can happen towards other dogs in the home as well. So, dogs might be playing. They might have a good history of playing, and the owner will contact me. I don't get it. They got along really well for many years, and suddenly they got into this fight. First thing I'm going to be looking at, is there any kind of pain-related issue there? Did the other dog cause that pain? And now the dog that is in pain is like saying, I liked playing with you, but that one time it really hurt, that when you did that weird maneuver and it got, so I'm blaming you, the other dog. And that's where the aggression occurs. So, so many different contexts in which this can happen towards owners or towards other dogs in the home, or even dogs that that might not be living in the home with that dog. So recognizing those contexts can be also helpful to diagnose or look for pain issues, because if you start to see it commonly in those contexts, that's where you'll know to say, okay, certainly new issues too, new behavior issues. If the dog's been with the owner or not had any aggression issues for 3, 4, 5 years, the first thing I'm looking at is saying, let's get your dog to the vet to rule out medical issues, because sudden changes in behavior are often medically related.
Yeah.
So look for that as well. Yeah. So that's just a short list, and we can keep going if you want. But,
no, I mean, I think the kind of gearing up for a walk is something I'd never really thought about, but obviously we've got dogs with sore legs that we're kind of lifting them up and moving them around to put them into harnesses. But also, I think it's really important to remember that even if your dog has got a diagnosis of arthritis in a specific location, it doesn't just mean that they have got the potential to be uncomfy just when you're touching there. We talk a lot about compensatory issues and referred pain. Just because they've got a sore elbow, actually they can have loads of trigger points and things up in their neck and their shoulders. So you've actually done nothing to their elbow, especially if you've got a harness that you can just pop on without needing to move their legs. But as you're approaching their back, they're suddenly going, oh, that's by my sore spot. So just be aware that your dog showing those little subtle signs, it's 100% worth telling your vet about that, because then for me as the vet, I would then immediately go, oh, let's maybe have a look at the muscles up here. Is there something else going on? Does that then need an adjustment to our medication plan? Is there a new type of pain going on here that we need to be thinking about? And it's those tiny little subtleties that are going to really help us, get to the root of what's going on and make sure that they're as comfy as they possibly can be, which is obviously all any of us want.
Yeah, and that's what, going back to, stressing the point, important point of working together as a team, is that sometimes behavior is going to be the only thing that really shows you that there's something painful going on, because the dog is either very stoic or masking and not showing the details of it, or maybe even the diagnostic testing that the veterinarians do may not reveal the issue going on without further digging. So sometimes the behavior will be the only thing that says, hey, there's something probably going on from a pain standpoint here. So, and I also wanted to kind of piggyback off what you were just saying earlier too, is that the associations that dogs create can sometimes spill over into other things. So let me give you an example to make it more clear. Like, let's say the dog has issues getting in and out of a car because they can't make that big step up into the boot or the back or something like that. And maybe we have to pick them up, or maybe they're hesitant about jumping out and we kind of coax them out or pull them out with a leash. And then they get that painful moment, jarring moment of hitting the ground, or, even just jumping onto the ground or jumping up into the car. But nothing happens there. But then suddenly the owner goes and continues to repeat that a few times, and they go to grab their car keys the next time, and the dog suddenly shows aggression towards them. Sometimes it's like solving a little bit of a mystery there. It's a little bit of a crime scene issue, but you kind of say, what does the car keys have to do with this? It's because the dog has formed the association that, hey, car keys predict the car ride, which predicts pain. And if you carry on, I've seen it, those associations, it's a stimulus pairing where it just goes on and on and on to, okay, it's now shoes going on, which means car keys are happening, which means the car ride is happening. So not as common, but it's something to be aware of. So anybody listening that does have aggression issues with their dog, pay attention to those things, because again, associations, dogs are very, very good about forming associations, sometimes negative ones. So
I mean, I've certainly seen a few dogs who have developed new fears of certain floor types. And, the owners will come in and be like, oh, but, why are they doing this? They're being stubborn. I've had this new floor laid. And actually, when you start looking into it, they had a slip once and they have remembered that floor or that type of floor hurt. And that's why that environmental management we talk about is super important as well, to try and get rid of any of those negative stimuli so they don't have that chance to build up those aversive sort of links. And then hopefully we can then de-escalate them back down again.
Oh, so it's such a good example, because I remember, or anybody who's fallen, right, or on a slippery surface, you're going to remember that. I remember I took a good fall and landed right on my rear end in front of my old house because the stairs were slippery. Ever since that day on those stairs, I was super, super careful. And, anybody that didn't know that happened would probably look at me like, dude, what are you doing? Like, why are you moving so slowly down the stairs? Because it was very painful for me when I fell. And I remembered it. So, and dogs are certainly going to remember those details.
But then imagine if you were doing that. So you'd had that fall, you had taken those behavioral steps to say, right, I'm going to adjust for this. I'm going to make sure I'm safe. And someone had a lead around your neck and was pulling you down at twice the speed you're happy to. As a human, you would have a very strong reaction to that. And you can then understand why our dogs might do the same thing. And I think the other thing that all of this kind of links into, we're talking always about, that there's ladders of things, there's different steps that go along the way, it's early intervention. Unfortunately, one of the sad facts about arthritis is we know there's very few situations where we can actually cure completely. So a lot of the time when we're looking at these patients, we're looking at that kind of long-term management plan. So that's then going to directly relate across to having a long-term relationship with all of the professionals that are involved in that team, because just because we've had one issue that we've recognized, treated and fixed doesn't mean that dog might not have issues further down the line. So, developing that really good relationship and that team communication we keep coming back to, super important to make sure that we continue to have really good outcomes for these dogs in the long term.
Yeah, that's a good point too, Jenny, because I think it's important because we make adjustments often to our own lifestyles because of our dog's lifestyle or what issues they have going on. And that can certainly occur with arthritis, right? I'm sure many of the listeners here are thinking about that through their own mind about, yeah, you make a life adjustments. Maybe you don't go for as many walks, or maybe you don't go for those camping trips or those hikes anymore, and so, but we also have to remember that can happen with behavior as well. So we need to sometimes adjust our own behavior so that way it suits the dog's needs at the time and where they are in their journey. Because behavior, just like health, it's not a light switch. You can't just go and say, I turned the arthritis off. Same thing with behavior.
I wish I could, but
right. And I wish I could too. Same thing with behavior. Yes, we can make things better. We can make things more manageable, more comfortable, but it doesn't mean that we can always switch off aggressive behavior or the potential for aggressive behavior, just like a light switch. We can certainly make it a lot better in many cases, and in some cases also make it completely extinguished or not surface again. But we do have to adjust our own behavior for that to happen.
And I think that sort of behavior adjustment is in our behavior. That's where stuff like this becomes so important. Getting that message out there that these are not bad dogs. These are dogs who are desperately trying to communicate to us that something is wrong, and we just need to learn to speak their language and to learn to listen to them and try and make sure that we're taking that message on board and not acting inappropriately for them, unfortunately.
There's a really great saying that dog trainers have, and I don't know who to give credit to, but it's been around for a bit. It's your dog is not giving you a hard time, they're having a hard time. And it's a very good, salient saying, because it is true. Your dog, a lot of people are with behavior, right? They get upset, like, especially if it's owner directed aggression. Think about the emotions involved, and how dare my dog bites the hand that feeds them kind of mentality that comes into play. And that's true. And it's, again, normal human emotions come in, like, I don't get it. And I buy my dog all their toys and their food and these comfy beds and all of this great stuff, and then they bite me. It's hard to understand that. It makes you feel like the dog's giving you a hard time, but oftentimes it's because they're having a hard time.
Yeah, absolutely. And I know we've sort of said it a few times, but that's where those tiny little subtle things, bring them into the vets, let us know what's going on. I guess if you had to sort of try and distill all of that wonderful amazingness that you've just given us into sort of 2 or 3 top tips for owners, what do you think they would be?
I think we covered some of them already, so I'll kind of summarize those, which is learning to recognize, what the dog is saying through body language. So there's many great resources. You can go on YouTube now and find dog body language videos, but starting to recognize those subtleties, because usually most, the average dog owner or in terms of, that's kind of a odd term, but somebody that hasn't been studying dog behavior for a long time might see the overt stuff. So they see when the dog is screaming at us, the growling, the barking, the lunging, snarling, snapping, biting. That's the dog screaming and yelling, hey, something's wrong here. But by learning the body language, you can start to hear when the dog's having a conversation with us. We can have that conversation with the dog saying, hey, I don't feel well here. Maybe I would prefer you not touch my shoulder right now, or put that collar on right now, through subtleties, tongue flakes, whale eye, half moon eye, turning away, stiffening, lip retraction. You get on down to the micro signals, change in respiration rate, whisker flares. I mean, you can get down to such minutia and the details that you can see things loud and clear. And so when you start to see that, now the dog's saying, hey, you're having kind of in the dog's world, a normal conversation, rather than the dog having to scream and yell at you saying, I'm in pain, bark, 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 lunge, bites, right? So that's probably the number one thing, recognizing body language. And the other thing we covered too, Jenny, was just recognizing the signs of when something painful might be happening. And the context that I was mentioning, slowly getting up from a bed, how they move their gait, what they do on a walk when outside, less likely to engage in play, less likely to play with toys, less likely to chew on something they used to chew on all the time. Are they having teeth issues? So, are they moving away from you when you try to pet them when they normally would engage in that? There's so many ways to say to look for those things when a dog might be in pain, and to investigate further. So that's probably number 2. And number 3 is don't punish your dog. Right? So don't punish your dog for trying to communicate those things, even if it is overt, because it can again seem offensive to us as humans when a dog's growling and lunging and barking at us, and scary as well. It's oftentimes, again, the dog just trying to say, I've got some trouble going on here, and it's either fear or pain or some discomfort. That is because most aggression is fueled by that. It's fear, pain, underlying discomfort, stress, anxiety. So, you can see just how counterintuitive punishing that would be, especially if we put ourselves in their shoes, right? We're in fear or pain or anxious about something. It usually doesn't fix it. It may mask it, and that's the thing about punishment, is it sometimes looks good on paper because it suppresses the behavior, but it doesn't fix the issue. It doesn't fix the underlying issue. If you truly want to address this issue with aggression, you have to look at the underlying reason for it and address that. Once you do that, then you're going to be in much better position to help your dog.
And I think there's so many parallels, if you just, again, if we go back to that arthritic versus aggressive dog, if we flip that conversation and instead of saying aggression, said lameness, you wouldn't see a lame dog and just label it as lame. You'd investigate it. You'd make sure they're comfortable. You'd rule out any underlying issues. It's exactly the same thing. It's just a different way of looking at it. It's teaching the owners those subtle communication things, whether that's for the behavior side or whether that's for the pain side, making sure the environment's appropriate, whether that's for the behavior side or whether that's making sure that they're not having those slips and falls and things. There's so many parallels we can see there, and I think probably a lot of our owners, their dogs, the fact that you guys are here and listening to this, your dogs are in that exceptionally wonderful bracket where you've got really dedicated owners who are really keen to understand that and make sure they know what's going on with their dog, and it's just getting that message out there to more people to help them see that too, and to professionals as well, for vets like me and nurses working in practice to have that understanding of what's going on and just have that awareness of the things that we're able to do. If we just look a little bit deeper and just dig a bit further below the surface, you can have some really wonderful outcomes.
Yeah. And everybody who's listening in, you can be helpful for this cause by, if you're on social media, occasionally you're going to get these videos of, a dog that is clearly having underlying pain or other discomfort issues, whether it's, not even necessarily physically, but more emotionally, fear or something like that. And you see a well-meaning trainer, and I'm using big air quotes there, go in and, they're very rough with the dog. And it looks really good to a lot of casual observers because the dog goes from barking and lunging at that person, and they stop because that trainer is maybe holding the leash out and hanging the dog out to the side till they stop, or using some other punishment-based techniques. And you have lots of unsuspecting observers saying, "Oh, that looks great. That's amazing. You're so great." And what we can do to help to send the message out there, we don't have to say, you're a bad trainer, just say, hey, there's other resources to check out, because some of these dogs can be in pain or have some other issue going on. And you list resources like CAM or, any of these resources that are going to look again at the underlying reason, not just saying, hey, this dog is being stubborn or aggressive or needs to be fixed, or he needs to be shown who's alpha and who's boss. And it's really tragic too. I see, unfortunately, a lot of these, if you're on Instagram or TikTok and things like that, you see, unfortunately, a lot of these videos coming on, and they get a lot of traction, which can set us back quite far if we're not more, if we can be, again, our dog's advocate by just, putting in little comments. People will pay attention to those things.
And again, it's that, flip the narrative. If you saw someone dragging a very obviously lame dog down the road, it's no different. It's still doing something completely inappropriate for that patient at that time. And it's not always fair. And I think one of the things you're being quite gracious about is, and I think you should be shouting and tooting your own horn a little bit here, is obviously you have some amazing resources with your website and things like that as well.
I appreciate that. Shout out. Yeah, I try to. I've got tons of free resources on my website. It's aggressivedog.com, videos, articles. There's actually a series of articles on pain and handling, so husbandry and handling issues. So dogs that do have issues with being groomed or pet or having their ears cleaned and things like that. It's all free on their site for those resources, articles. I have videos on there as well. So yeah, it's I think unfortunately it's tough to get those things to go viral because people often pay attention to that flashy sort of quick fix type of stuff that our society,
you know what, though, we are getting quite a few comments of people saying they love your podcasts, so you are definitely out there and you're going viral in one way or another.
I appreciate that. Yeah, it's the Bitey End of the dog, Vicky. So I saw somebody ask that. The Bitey End of the dog on you can find it on most platforms, and I've had a few veterinarians on there too. Dr. Debbie Gross-Taraka, who I know has been a guest on here, is I did a podcast episode with her on pain and aggression. So
yeah, and I think it's important to make sure that people are obviously aware that there are really good resources out there, and it's organizations like CAM, it's people like yourself who are putting that message out there that help. And thank you to all of our viewers, because the fact that you guys are here and watching, that's already spreading that message further, and it hopefully it's just going to build and build and build, and we're going to, even if this makes a difference to one dog, that's amazing. If one dog's life is better from the fact that someone's watched this video and gone, oh, that's my dog, wonderful. That's exactly why we're here talking about this.
And listen, guys, it's getting out there, because you see big companies like Petco, for instance, removing shock collars from many of their shelves. It's a step in the right direction. Do they still sell aversive equipment? Sure, but that's a huge step in the right direction of what we're trying to do. We see the fear-free veterinary movement, and that becoming more of a mainstream. A lot of my clients are actually mentioning that before I mention it to them, which is saying that the word is getting out there. So yes, we have things to compete with. We have TV shows and we have social media and things like that to compete with, but I think we're certainly moving in the right direction with the message we're putting out there. So keep it up for sure.
No, I mean, I just wanted to say it's been absolutely fascinating to be able to talk to you about this, and I love how many parallels there are. Again, I know I keep coming back to it, but I just think it's amazing, that aggressive versus arthritic dog, because it's so true. It's just changing your framing of it and how you then think about that case and how you approach that patient. For me as a vet, that's an amazing way to change it. But it's also then thinking about, yes, there are obviously wider causes of things, and it's a symptom, not a label. It's something that we can't go around just sticking this label on this dog that will follow it around for the rest of its life. We need to really think about why it's happening, and make sure there isn't an underlying cause that could be managed and treated, and listen to our dogs with what they're telling us. Because when it's aggressive behavior, they are, as you say, screaming at the top of their lungs at us. Have we missed the more subtle ones further down the line?
Absolutely.
Is there anything else you wanted to add before we say goodbye to our lovely followers for the evening?
I don't know, many things I would ask of you. I would love to continue this conversation all day. Always love chatting with my colleagues. But yeah, I guess the takeaway message is to again, look at the underlying motivation for behavior first. It's important to be an objective observer as well. So we see behaviors, and that's how I define aggression. I don't call dogs, even though again my website is aggressivedog.com. Jenny and I were chatting about that. Good for marketing, but I never label a dog actually an aggressive dog. I look at the behaviors. Hey, this dog is barking, lunging, and growling at somebody when they try to pet it. And that's much more helpful without putting a label on the dog. Then we say, well, why is the dog barking, lunging, and growling when people try to pet it? That'll shift our mindset and to saying, hey, there's got to be a reason for this, not and getting more objective about the reason, more scientific too about the reason for why. And it's oftentimes going to, again, shift how we think about things, how we want to treat that, because it's usually one of the motivations is something that's going to hit us emotionally. It's we don't want to see anybody in fear, or any animal in fear or in pain or having high states of stress or anxiety or discomfort. And because there's very few dogs that are doing this for fun. There are dogs that do it for fun, and but that's far and few between. Usually they're purpose-bred, protection trained, or when it's part of their genetics, and that's a whole nother conversation on them. But the vast majority of dogs out there that are displaying aggression issues are doing it because of fear, underlying pain, medical issues. Nothing that is willful or spiteful, right?
Yeah, definitely. And I think my probably final thing that I want to say is, please never be afraid to come to your vet and say that you're worried. I think people sometimes think that they'll come in, say their dog's aggressive, and there'll only be one solution that we'll offer. But actually, it's that dog language. It gives us the chance to try and help if we can. So don't ever be afraid of coming to us and talking to us about it. It's never something to be ashamed of either. I think some people sometimes worry they've maybe done something wrong with their dog. Never, ever, ever be ashamed of it, ever. Come and speak to us. Open up those lines of communication. We can get that team involved. We're here to help you and here to help your pets.
Very good takeaway. Definitely.
Useful. Well, thank you very, very much to all of our lovely viewers, but also obviously to our sponsors as well. So the wonderful people at Barker Beds. And then just a reminder for everyone that we have still got time to sign up for that big walk. So it's starting at the start of September, still loads and loads of time to sign up. And as I said at the start, any RVNs who are watching, it's free for you guys to sign up for the big walk this year. So please go and get signed up. But we will sign off. So thank you very much, everyone, for joining us this evening.
Thanks, everyone.
Bye.